the highest ever levels of fat oxidation ever recorded. And what this showed us is that all these assumptions we had since the 1960s, that carbohydrates were essential to performance and that you needed carbs to perform, even at the highest intensities, never took into account that that isn't actually always the case. When you actually put that to the test and you put people on these ketogenic diets, absence in carbohydrates, nearly absence in carbohydrate, they're relying on fat as a fuel. And then you push them to high intensities when you don't just assume, you actually test it. The test did not come up to meet the hypothetical assumptions that these textbooks would tell us would come true. And so that totally changed the entire thinking by our group around these diets and performance.
And yet, so it's a remarkable finding. I understand everything you just said. It made sense logically. And yet at the same time, sort of the counter view of this is very compelling. So there was no difference in performance. They were burning a lot of fat. As long as they were fully adapted to the ketogenic state and they were in fat burn mode instead of carb burn mode, and they had fully transitioned, you guys found they performed just as much. But earlier we talked about muscle, and we talked about how glycogen is bound to muscle, and glycogen in the muscle is used by the muscle for energy, and glucose is this preferred fuel source. How on earth would these athletes on a ketogenic diet that were performing at the same level they were performing at previously or subsequently on the high carb diet, how were their muscles doing this? And what did the glycogen in the muscle look like? Was it fully depleted? Was it still there? What was going on? Do you know that?
So when we were looking at these athletes, we know that when people go on a ketogenic diet, any study that's ever assessed muscle glycogen, 3 months or less on athletes, they all have reduced muscle glycogen. We know that, going on low carbohydrate diets initially within the first three months always causes a reduction in muscle glycogen.
Not surprising.
So this
right?
is just
they're eating less carbohydrate. There's less stored in the muscle as glycogen.
100%. So this would be totally expected, by the way. But yet they were still performing exactly the same. And what was really interesting is that they were reducing the amount they were utilizing in carbohydrates. So the amount of carbohydrate oxidation or carb burning they were doing, again, which was associated with performance before, was dramatically lower. But yet they were performing the same because their fat oxidation was through the roof. It was showing that fat could actually sustain performance at these extremely high levels. Now, here was the kicker though, Nick. It's like, okay, well, if they're performing the same, why does it matter? Well, keep in mind that these diets have been used therapeutically for over 200 years to correct for medical issues, obesity and diabetes being the most historically known. Well, we also found that in these athletes who are all fit, normal body weight, high VO2 maxes, so one of the strongest metrics of fitness in athletes that we know of, these athletes, 30% of them, when we assess their glucose levels continuously for over 4 weeks, every 5 minutes for 24 hours over 4 weeks, we found that 30% of these athletes only on the high carbohydrate diet, so following sports nutrition guidelines, were developing glucose levels consistent with prediabetes. So they weren't, so there was a consequence to their fueling strategy. So it wasn't just about, okay, you can perform the same on either diet. Now it was a question about health, Nick. Now it was a question about, oh, wow, okay.
Right, and long-term sustainability.
Correct. So you have two factors. You have the health factor, which you're seeing an issue related to health. And then we'll talk about sustainability here in a second.